room and the seriousness in the room. I was wondering if I can out of protocol and just break the ice a little bit before I share my speech. Doctors, am I allowed? Am I allowed, doctors? Okay, the first one is an advice. I went to the centenarian event of Dr. Evans, who obviously is one of the pioneers. And in one of his stories, he said that he was on leave. This is many, many years ago. And then he gets a call from his supervisors to say that he had been transferred to Tamale. And he only had 2 days to get ready and go. And so he said to his supervisor, oh, and the man says, why? And he says, it's far. And he said, it's far from where? Pack your things and go. So to all those who accepted postings outside of your comfort zones, we say congratulations. Now, yes, of course, let's clap for all those who went outside of their comfort zones. This has no bearing, just to lighten the atmosphere. See, I've always loved tradition, and I've always, behaved as though I was a chief. So this was many, many years ago, and I followed a cousin to an event. And as soon as we got to the event, they assumed I was a chief. So they started giving me protocol as a chief. This was somewhere, probably 88. I was nowhere near. I didn't even have a dream that I was going to be a chief. And it was a leaving due for PTC, teachers. Somebody was graduating from PTC, so was having a little our day, as we may call it. So we sat in the room, and everybody had a plastic cup, and they were sharing the soft drinks in plastic cup. But because they assumed I was the chief, I got a bottle. And I was quiet, I didn't say anything. I went there with a cousin, and I don't know why, but we were really, really hungry then. So there was a bowl of chips, and I'd just been served chips, and I'll come back to it. So they were going around with the chips, and then everybody picks a handful, and then it goes around. So when the tray of chips got in front of me, the girl left it there. So I was eating. And then there was a grandma at the event, and she told the girl, "Yeah, come tray and okay around." And the girl said, So about 3 minutes will go by, and then she says, and then the girl says, look, I'm shy because he's a chief. So grandma sits there about 5 minutes, manching pure chips again. Man, manching pure chips again. So anywhere I go and I get served chips, I remember those days. But I didn't introduce myself as a chief, they just assumed. But let me introduce, to my left here is my son Yao. This exquisite gentleman here is literally Ken Ofuriata of Edumasan, so he's my Sana Hene, and Sana is in charge of all liquid assets in Edumasan. And so that's Nana Akwafu Irenchi. Big chief on the table there, donned in the black and white cloth, is Nana Olympio, and he's Nana Asonka Hene. I came with my two sisters, Ama Labi Sound and Yenima Jampo. The founder and national president of the National Medical Excellence Award, various regional health directors, medical superintendents of various health facilities, chief executives of the various companies, invited guests, the media, ladies and gentlemen, and all protocols observed. Now, once upon a time in 2011, there was an initiative to recognize people in the health sector. This initiative was well thought of, analyzed, and implemented by a noble, humble, and creative man, Dr. Dauda Tavitus. I think he deserves a round of applause. Life is all about identifying a problem and finding a solution to that particular problem. To him, the problem was with the fact that the health center, pardon the DJ and his instruments. To him, the problem was with the fact that the health sector of Ghana has no recognition for their workers. So an award system to award deserving ones will not only recognize these hard-working workers, but will also motivate their work in the various sectors. Mother Teresa once said, the greatest disease in the West today is not TB or leprosy, it's being unwanted, unloved, and uncared for. I feel important and honored today because there was never a second thought of accepting to be the royal guest of honor to this 5th National Medical Excellence Award. As you may know, originally it was the Manfrihene of Saberima Ansah. So he gave me a call, and due to some urgent family matters, he wasn't able to come, and asked if I would be able to come. I said, you know what, why don't you call the doctors and see if they'll have me, because I'll be very, very happy to attend. But let's find out if the doctors want me. So I got a call back to say that yes, they wouldn't mind me being here. So I say thank you very much. I want to thank the organizers and assure the organizers of the National Medical Excellence Award that it was a great decision they chose to celebrate healthcare delivery personnel across the country, from private, public, and mission hospitals. I want to crave that they employ all necessary skills to make it a success and make sure all needed resources are available to execute subsequent editions. My doors are always open for assistance and guidance in all forms. As you all know, I'm also in the media, so wherever it is I can do to help this noble cause, I will. This exercise is important to me. I believe your services as health workers will be much graded by the people your services are rendered to. Ghana Health Service seeks to serve patients in a conducive and friendly manner, and this has to reflect in the work of all health workers. As a country, we all must ensure these are done without thinking of individual benefits. Our health is very important. Our health is very important. There is an adage that says good health is wealth. How would we live if we do not have good health? The citizens need good health, and these services are found in hospitals. I will advise all hospital personnel to take their work seriously, from the doctors to the cleaners. Let us practice good hygiene in our hospitals, give proper care and attention to patients. Let us find love in our hospitals through your services and relations with colleagues. As the theme for celebration is, motivated health personnel and regular preventative health reviews, solution to unexpected death. To know your health status will help reduce unexpected death. And I have arranged with the award screening team to visit the Eastern region, and I ensure that my people receive their fair share of the cake. The only republic within the republic, the little republic of Kwao. In conclusion, I want to thank the President of the National Medical Awards for the opportunity. To all who have gathered here, I know you believe that the healthcare personnel deserve to be celebrated, hence your acceptance to be here. Let's all support and promote this award. Thank you very much.